My name is Heather Strobel. I'm going to do a presentation on celiac disease through this PowerPoint. So let's get started. In order to understand how celiac disease manifests in your body, you need to understand how the GI tract normally works. Just the normal aspects of an undamaged, undiseased GI tract. So on the second and third slide, that's what I've included in somewhat more detail. Intestine. It's considered autoimmune and hereditary. There's two genes. People with celiac disease or being diagnosed with celiac disease often have one, if not both, of the genes. But if you do have one or both of the genes, it doesn't predetermine you for celiac disease. It doesn't mean that you have it or even that you will be diagnosed with it. They are called HLA-DQ2 and HLA-DQ8. HLA stands for human leukocyte antigen, and these are actually genetic markers for celiac disease. The problem child here is gluten. When we ingest gluten, those with celiac disease, the body recognizes it as a foreign protein. Gluten is a protein that's found in wheat, barley, and rye. It's rather large, so the genes actually cause the gluten to be unable to be broken down, resistant to the breakdown process. Usually proteins are broken down into smaller peptides, amino acids. You'll also find gluten in other products such as baking goods or cereals or pastas. And so reading every single label becomes a part of your life when you are diagnosed. It's considered autoimmune because it activates an inflammatory immune response. It can affect children and adults most often. It's diagnosed in adults. It affects the small intestine, but it can cause damage to any part of the gastrointestinal tract. It's multisystemic because of the different symptoms that are caused from the malabsorption in the small intestine of different nutrients, vitamins, minerals that your body needs. It is chronic. It happens over a period of time, depending on how much ingested. Depends on how much damage is done to the small intestine and other symptoms that will present. So the inability to break down the gluten protein leaves them in larger peptides. When they cross the cell membrane, it causes damage. So then your inflammatory immune response is activated to go and attack those dead or damaged cells. So your small intestine is lined with lots and lots of villi. Villi are like finger-like projections that increase the surface area in the lining of your small intestine for more and better absorption of nutrients, vitamins and minerals that you need. So when the immune response is activated, it actually destroys the villi. So it pretty much just it cuts them off. It levels them out so that there's not enough surface area for all of these nutrients and things that we need to be absorbed by our body and used. So they actually pretty much just get wasted. Symptoms are individualized. It depends on how much gluten has been ingested, how much damage is done to the lining of the small intestine. Often the presenting symptoms will be abdominal pain, maybe diarrhea, herpetiformis. These are the things that often cause people to seek medical attention. the malabsorption issues with the decreased surface area with nutrients, ones might present with weight loss or poor growth repair. Water will present with diarrhea. Potassium, that can cause fatal, sometimes, cardiac disorders and arrhythmias, severe muscle spasms. Fat, if fat is not absorbed or digested properly, it'll just go through the digestive system. You end up with steatorrhea then. Vitamin A is good for wound healing, vision acuity. So if these people are not absorbing vitamin A, they could get decreased wound healing, skin issues, the hepatoformis, maybe vision changes, vision damage and problems. Vitamin E, you get neuromuscular or poor coordination. Vitamin D, you're unable to absorb calcium the way you need to. Vitamin K, you can end up with bleeding disorders and different things. Vitamin B12, fatigue, your body's not going to be able to produce or maybe red blood cells the way it should be able to. Nerve damage is often permanent. And it could even be something like numbness and tingling of the extremities. But more than not, it is going to be permanent. So assessing these patients, they can have one, most often more than one, and any different combination of symptoms. So you have your subjective, how do they feel, what are they telling you, things you can't see, things you can't prove with a test. And then you have your objectives. These are concrete symptoms that you will be able to look for. So children often have different symptoms than the adults will. They may have poor appetite, vomiting, maybe a swollen belly, chronic diarrhea, delayed puberty, ADHD, different things like that. So no are often not alike. Um, to test for this, there's antibody tests. These are blood tests that can be done. But the only thing with these are gluten has to be a part of their diet in order to get a positive result. If it's positive, then you can do an intestinal biopsy to see how much damage is actually done to the small intestine. You would do a skin biopsy for the dermatitis hepatiformis. That's the blistering skin rash that you can have, and then the immunoglobulin A also would be a test that maybe they can do. Gluten-free is the remedy. There is no cure for this. Gluten-free lifestyle, gluten-free diet is the only way to help with the symptoms, to help with the damage that's done. You might be able to get some help from a dietitian. These are professional people that know the ins and outs of nutrients and minerals and vitamins and things that our body needs and how you can get it. Because of the malabsorption of the vitamins and minerals, you may need to supplement some so that your body is getting some of what it needs. There's different ways that you would be able to receive the vitamins and minerals. Maybe they're orally in a pill or something you can drink, or that might be absorbed better. Steroids are often prescribed to assist with the decrease in the inflammation. The inflammatory process that's going on inside your body, and the steroids will kind of calm that down. You pretty much just have to learn to manage. What's your role as a nurse or as a caregiver? Teaching is the best. The should and should nots of a gluten-free diet, replacement foods that you can um, have instead of totally depriving your body of the things that it needs because you can't eat what you want anymore. Um, Replacement foods, avoid canned fruits and vegetables, canned foods, period, different soups, processed meats, get the good stuff, freshly prepared veggies, fruits, fresh fruits, meats um, that don't have any additives, different fish. Read labels, all of them. Um, Lots and lots of things have gluten in them. Even they might even say that they're gluten free, but you still need to read the labels because when you ingest gluten, even a little bit causes damage to your um, small intestinal lining. Um, Educate the family and the patient and any people that may uh, help them with support. Um, these are just some foods that you can eat and things to run from. Beer is often has gluten in it. Um, Really, just about anything that's processed. And then when you do use different flours that you're able to use, corn flours and almond flours, and if it's rice based. Um, Cutting gluten out of your diet will improve symptoms. You might start to see them in a few days, but the longer you go without gluten, the more repair the damage it can be done. Maybe a slow process, but uh, you should start to feel better. Just a little bit of food for thought, a little bit of history of how uh, celiac disease come into play. Um, and when gluten was discovered to be the main contributor after these doctors were noticing um, worsening conditions, diarrhea and malnourishment. And so the missing piece is um, the surface area. Don't have the surface area anymore after the villi have been damaged and destroyed uh, for the nutrients and the minerals and things that your body needs um, and needs to utilize. When the surface area is gone and reduced, then all of these different symptoms and um, malabsorption problems will come into play.